Inline Physio, and this is Vanessa, our brand new physiotherapist. We just wanted to do a quick video in relation to pain of the knee, and in particular kneecap related pain. So we're just going to run through a few common symptoms that we hear, and then also look at a few of the examination findings that are common when your pain is coming from your knee. Okay, so commonly when a patient comes in complaining of knee pain, if it is coming from their kneecap, they'll usually be complaining of pain underneath their knee or kind of deep underneath the surface of their kneecap. They also may have a lot of tightness and pain on the outside of their kneecap due to kind of pulling of structures out there and the kneecap tracking slightly up and irritating the structures underneath the bone. They could also have a bit of swelling around the bottom of their kneecap. So that's pretty much the area of their pain, and so functionally the activities that they usually find painful are descending stairs, descending hills, giving way episodes. So if they are kind of starting to descend the stair, they might feel a bit of pain and a bit of giving way and weakness of their knee. Also sitting for long periods of time. If they're sitting in the movies, for instance, they'll start to get a bit of achiness in their knee because their kneecap's under a bit of load when their knee is bent. So they might get relief when they actually straighten their knee because it loosens up the kneecap and takes the pressure off there. Kneeling is another actual activity that's quite painful. So if you imagine, Vanessa, if you kneel down on the floor, imagine all that load going through that kneecap. If there's a bit of bony bruising, then that's going to be quite painful as well. Okay, so when we're looking at the functional activities of our patient, if they are complaining of pain when they're going down the step, we want to have a look at how they're doing that action of a single leg squat. So what we commonly see with patients with kneecap pain is that when they are doing a bit of a squat, so Vanessa, just get you stand on one leg there, they'll tend to want to go inwards with their thigh. So if their thigh comes in, their kneecap starts to pull out. They can also get their foot rolling in. And so all this kind of alignment changes the tracking of the kneecap and can irritate the bone behind it, and that will be causing your pain. Okay, one last final thing that you can look at yourself at home if you do have knee pain is compare the muscle bulk of your knee. So if you've got one knee that's painful, often what happens is we get wasting of the muscles around the knee. In particular, we get wasting of your VMO muscle, this little muscle on the inside that bulges. You'll see the footy players have a massive VMO muscle because they need that control. But with Vanessa here, hers is just average. So we'll just get you to squeeze that as hard as you can there, Vanessa. That's it, good. So if you did that yourself at home and compared it to your non-painful side, you may see that it's actually smaller in size and a little bit softer. So that's really important to rebuild and strengthen as part of your rehab program in order to regain control of your knee. So if you've got your kneecap tight on the outside and weakness on the inside, your kneecap's going to track slightly out of its little groove, and that gets very irritating. So we need to target that with our rehab. Okay, so that pretty much sums up a very simple overview of knee pain, in particular kneecap related pain. If you are experiencing pain of any kind, we're really keen to see you and try and help you out. Give us a call, or you can book in online. Thank you.